Assalamu alaikum طلاب. This is the practical slides in the practical session of the week 3 cardiovascular system pathology. This picture, gross picture of the normal lung in the left and in the right congested lung. Look at the difference. The congested lung appear as wet and heavy with dark red color as the blood engorge within the capillaries. This is the second picture is the liver, congested liver. This appear as this portion is congested and appear as a dark red wet and in compared with the light pink normal portion. Chronic lung congestion microscopic picture. This microscopic picture of the lung. This is the alveoli, back to back alveoli, and this is not normal alveoli. The wall alveolar septa is thickened, widened, and the blood capillaries within the wall engorged, dilated and engorged with the red blood cells. There is minute intraalveolar hemorrhage with characteristic heart failure cell, which is hemosiderin laden macrophage inside the capillary, engulf blood, and characteristically occurred in chronic lung congestion, as we mentioned in the lecture. This picture, microscopic picture of chronic hepatic congestion, as we mentioned in the lecture, it's grossly appear as a not made liver, يكون منقطة. فمايكروسكوبيكلي هذه النقاط من تجي. هذا هو السنترال فين وهذه اللي area immediately adjacent to the central vein appear as pinkish light pink which is necrotic. هذه الاريا اللي هي تكون periportal adjacent to the portal tract. هذا هو البورتال tract. شو تكون usually preserved as appear as a darker than the necrotic area. هذه هو يعطي شكل nutmeg liver. هذا هو البورتال tract اللي هو يحتوي على البايل duct, البورتال artery and portal veins. Well, as we mentioned, the structural building unit of the liver, it's a hexagonal structure, central vein in the middle, surrounded by 6 portal tract. فهذه الصورة فقط مأخوذة من وحدة من البورتال تراكت. هنا أنا أكو أيضا، وهنا أنا تخيلوها أنه على شكل hexagonal structure. The gross picture during post-mortem dissection revealed thrombus in the inferior vena cava. فهذا اللي grossly thrombus appear as a dark red mass, dark red to brown mass. A gross picture in fibrinous pericarditis اللي هي تكون واحدة من المانيفستيشن of acute rheumatic fever. The epicardial surface of the heart shows a shaggy fibrinous exudate. This is an example of fibrinous pericarditis. Usually, normally smooth epicardial surface, but this appear as shaggy due to exudate in the fibrinous pericarditis. This is the gross picture of aortic valve in chronic rheumatic heart disease. As we mentioned in the lecture, in chronic rheumatic heart disease, characteristically there is thickening and fibrosis of the valve affected by chronic rheumatic heart disease. الفايبروسيس appears grossly as a whitish color. مثل تشوفون هذه الكالر هي white، طبعا النورمالي هي light pink normal valve، لكن هذه هنا fibrotic also thickened الwall thicker than the normal heart valve wall. This is the gross picture of the mitral valve appear as fish mouth shape, which is characteristic feature in chronic rheumatic heart disease due to fibrosis and scarring due to fibrous deposition, appears then as a fish mouth appearance. This is the gross picture in calcific bypass aortic valve. هذه هي aortic valve bypass, only two cast, and this mass appear, which is a calcification in the leaflet of the aortic valve. This is the calcific aortic stenosis, but it's a three cast. This is the chalky white deposit, which is the calcium deposit. This is the microscopic appearance of acute rheumatic myocarditis. Characteristically, there is an ash of body. This is an ash of body, which is a granulomatous reaction in the center. هذه اللي light pink, there is collagen and necrotic deposit surrounded by chronic inflammatory cell here, lymphocyte, plasma cell and macrophage. وهذه هي الميوكارديك مايوسايت، وهذا هو الأشوك بادي اللي هو عبارة عن collection of chronic inflammatory cell around central necrosis. This is the another histological picture of أشوك بادي. هذا اللي هو أشوك بادي. هذني اللارج cell هي الماكروفاج، السمول cell هي الليمفوسايت، والبلازما cell عندها eccentric nucleus. وهذه الصورة هي للانتسكو cells. انتسكو cell اللي هي قلنا الكات section nucleus like owl eye, while in the transverse section longitudinal section appear as a caterpillar nucleus, as a caterpillar. This is in acute rheumatic heart disease. Small verrucous vegetation along the closure of the mitral valve associated with acute rheumatic fever. As we mentioned, acute rheumatic fever, there is a small, شوفون, very small vegetation on the line of a closure of the valve. هذه الvegetation هي light pink soft mass. This is the vegetation over the mitral valve surface and the chordae tentonae in systemic lupus erythematosus, which is consistent with Liebman-Sack endocarditis. This is another picture of vegetation, small pink vegetation in the rightmost cast margin, typical finding with non-bacterial thrombotic endocarditis, also called marantic endocarditis. شوفون vegetation more larger than the vegetations of and more irregular than vegetation of the acute rheumatic fever. This is the histological section, microscopic picture of vegetation in infective endocarditis. This is the valve, and this is the attached friable vegetation. هذه هي الفيجيتيشن. This consists of the clots. هذه اللايتر pink والdark blue dots, which is the bacterial colonies and mixed inflammatory cells. In compared with another histological section which showed bland vegetation. This is the valve, and هذه هي الفيجيتيشن اللي appear as light pink. السيلولار ماس ماكو سيل، no bacteria، يعني ماكو هذه dark blue dots اللي bacterial colonies and no inflammatory cells also appear as a dark blue dots. يعني نرجع نقارن هذه الفيجيتيشن، هذا الميترال فالف سوري it's a heart valve، هذه الفيجيتيشن، هذه الدارك blue dots هي bacterial colonies. هنا only clot, only thrombus, no inflammatory cell, no bacteria. Thank you.